This is a big question and a big topic because people think that because I help people lose weight naturally, I'm highly opposed to Ozempic, but I'm not. I'm opposed to the dosing. I'm opposed to the fact they don't cycle people on and off of it. And I'm opposed to the fact that we're telling people it's normal to have nausea, vomiting, and constipation and no appetite at all as a way to lose weight, because to me that sounds like the eating disorders that we tell people they're going to have a problem with. My other thing is the number of people that I have seen who have nutrient depleted themselves while on these medications into a thyroid dysfunction, into early menopause, like in their late 20s, early 30s, and into osteoporosis by age 32, because they're not getting enough simple nutrition. If you feel like this is your only option, you should also find a really super amazing gut motility supplement so that you have a bowel movement every day, so that you don't end up in toxic overload because stuff is just sitting in there, and you don't end up with a bowel obstruction, because that for sure can happen. And you don't end up with gastroparesis, which in some of these people is permanent. You should also find a really great liquid supplement for vitamins and minerals, like base vitamins and minerals, that is liposomal. If you need one, let me know. I can email you a link to one. You should also find a liquid liposomal vitamin D, because you're probably going to struggle with that. And make sure that you're getting at least 120 grams of protein a day, because you need it. And of all the things that I can say frustrates me is this does not fix your relationship with food. So if you come off this medication and you go back to eating everything you were eating before, you haven't fixed the problem. And that's a problem, because then you become dependent on this for life, which means that you're more likely to have the severe complications that they're finding, like people who've been on it for a decade because of diabetes and are now having atrophy of the optic nerve and blindness. So it is not glaucoma from their diabetes. It is literally their optic nerve deteriorating. Getting osteoporosis in your 50s and 60s is bad. Getting it in your 30s is like a death sentence. The inability to build lean muscle, also super bad, because it's destroying your metabolism. And that's the other thing, is they've done the clinical research, and a very low calorie diet, which for women is anything less than 800 calories, for men anything less than 1200, for longer than 6 weeks we start to see nutrient deficiencies. A low calorie diet, which is less than 1200 calories for women, which is technically clinical anorexia, and 1400 calories for men, technically clinical anorexia, and we start to see nutrient deficiencies at 12 weeks. So we have to find a balance, and we have to make sure that people have the basics of what they need. A good liquid multivitamin, a good liquid liposomal multivitamin, a good liquid liposomal vitamin D, a good magnesium, something to help with gut motility, and also making sure that we're doing the counseling and the work on your relationship with food. And then you need to exercise every day. You need to move every day. And I don't mean like you have to go to the gym. I mean, if you're a woman over the age of 30, you definitely should be doing some resistance training, because you're going to lose muscle anyway, whether or not you're on Ozempic. But you should be moving for 10 to 15 minutes after every single meal. It helps lower the insulin response to food, because it helps lower the impact of the meal on your blood sugar. That's my feelings on it.